So Tylenol causes autism, right? I had a patient who came in, he was a 60-year-old gentleman. He came in for knee pain. And randomly, as I was getting ready to exit the room, he asked me, I have one more question for you. Does Tylenol really cause autism? I was really taken aback because it had nothing to do with his visit, obviously. But nonetheless, it's a very important question that all of us need to look more into. I have a question that I generated, brought to you by Boardmaster. You have a 30-year-old pregnant woman who is concerned about taking acetaminophen for her headaches as she has read conflicting reports about its safety during pregnancy. She specifically worries about potential risks to her child, such as autism or ADHD. Based on recent sibling control analysis studies, what can you tell her regarding the use of acetaminophen during pregnancy? The answer is C. Acetaminophen use during pregnancy is not associated with an increased risk of autism or ADHD in children. There was a study recently published by JAMA about acetaminophen use during pregnancy and children's risk of autism, ADHD, and intellectual disability. This was a nationwide cohort study with sibling control analysis included in a population-based sample of over 2.4 million children born between 1995 and 2019, with follow-up through December 31st of 2021. So they did a sibling control analysis because siblings are the most similar, genetically speaking, right? It concluded that acetaminophen use during pregnancy was not associated with children's risk of autism, ADHD, or intellectual disability in sibling controlled analysis. This suggests that associations observed in other models may have been attributable to familial confounding. What is familial confounding? Familial confounding refers to a situation where genetic or shared environmental factors within a family influences both the exposure and the outcome being studied. For example, if a study finds that children of smokers have high rates of asthma, familial confounding might mean that it's not smoking causing asthma, but also shared genetic predispositions or environmental factors common in the families. Using this study, we're able to see that there are a multitude of factors we need to consider for blatantly saying whether or not Tylenol does cause autism. I hope you enjoyed this video. If you have any questions or comments, please share them below. Otherwise, this is Dr. Abuzor, and I'll see you in the next video.